So welcome, Dr. Magda Botha. How are you doing today?
Thank you very much, Rita and Temke. It's an absolute pleasure coming back to my passion and my love, which is not only nutrition and dietetics, but also breastfeeding. I'm looking at a different point today. So, Rita, can I please, will you please tell me if you can see my screen? Can you see my screen? Good. So what I'm going to do, I think most of the people know me. You saw my face now, and I'm going to switch off my video so that you can focus on my slides and not on me. Okay, so when we talk about breastfeeding, we usually forget about nutrition, and we usually forget about nutrition during pregnancy and how to help a mother to prepare for breastfeeding during pregnancy. So, although there's various factors that is influencing the outcome of pregnancy, healthy eating remains a vital part for the mother and her unborn baby. We find that a healthy diet is very important not only for the baby but for the mother as well, and it plays an important role in the baby's birth weight at birth. It will also, in a later stage of life, it will prevent the baby from obesity, heart diseases, and diabetes. But then very important also is while the mother is pregnant, it also prepares the mother's body then for breastfeeding. So very crucial part of this healthy eating then is we have healthy food, drinking plenty of fluids during pregnancy, a pregnant mother that needs to be active, and that will then set her up for success during breastfeeding after the birth of her baby. When we talk about healthy eating and living, it is important to understand it goes beyond just nutrition and healthy living. There is the support system of a mother, there's the mental health of a mother, there's the spiritual well-being of a mother or the pregnant woman. But for the purpose of today, we will only focus on nutrition and healthy living and how that will support the mother to set her up for success in breastfeeding after the birth of a baby. Now, it's very important to understand that there's general healthy eating guidelines that we will focus on today. But then also when a mother has a certain health condition, for example, she's suffering from diabetes or she has congenital heart diseases or any other disease, it is important that she consults a dietitian or a nutritionist so that that dietitian and nutritionist can guide her to the best of her own circumstances. So today, like I said, we will focus on general healthy eating guidelines. So in generally, it's important that a pregnant woman enjoys a variety of food. We know that the need now for proteins, for vitamins, for minerals, for energy has increased during the pregnancy period. And in order for the mother to make sure, or the pregnant woman, to make sure she can provide in that increased needs for nutrients, it's important to eat different types of foods at different stages or different meals during the day. The more variety she has and include, the more different types of nutrients she will include into a diet. Then make starchy foods part of most meals. This is not the time that you want to go on the banting diet. This is not the time that you want to be carb conscious. This is not the time that you want to see how many keto friendly recipes you can follow. Because ultimately starch is important for energy for the pregnant woman, but it is important for the growth and development of a baby. So make sure with every meal that there is some starch foods included in that. It doesn't have to be mainly starch. If you look at the plate next to the written part on the right hand side, you will see in the plate. I'm not sure if you can see my mouse. Sorry for that. You will see on the plate on the right top corner of a plate, that is how big your portion is. It's 1 to 2 spoons, dessert spoons of starch that she needs to eat. Eat plenty of vegetables and fruit every day. between 5 and 6 portions of fresh fruit and vegetables every day is adequate. So how big is that portion? As big as what you can fold into your hand. If you eat an apple, it shouldn't be the biggest apple. Um, a bigger apple of the biggest apple is 2 portions. When the mother eats fruit and veg, preferably raw, as we know that cutting and processing and cooking will then also have some of the water-soluble vitamins being dissolved, and then it automatically decreases the value of that. Also, it will provide then fiber, which is important for the pregnant woman. But very important, vegetables and fruit needs to be washed before it's eaten, especially by a pregnant woman, because there might be pesticides that is affecting the growth and development of a baby. Now, in a case where a pregnant woman is not suffering from bloating or gas or discomfort, it can also be wise for her to eat dry beans, split peas, lentils, and soya regularly, because that will also add then onto the fiber content and the increased fiber needs that she has during pregnancy. Um, Another important food group is milk, maize, or yogurt that should be eaten 2 to 3 portions every day. You need to understand that the baby's body needs to develop. Calcium is necessary, vitamin D is necessary, and also phosphorus is necessary for the development of the teeth and the bones of a baby. Now, I remember one of my lecturers many, many years when some of you were not even born, um, said that we need to understand a fetus is very selfish. If there is no calcium provided out of the diet of a mother, the bones of a mother will then be the source of calcium for the baby. And in some cases, when a mother does not include, or pregnant woman does not include any dairy products in a diet, we find then that osteoporosis are very common. So in order to prevent that, dairy products needs to be included. In a case where she's allergic to milk and milk products, then it's very important that a dietitian or a healthcare worker helps her to choose the right type of calcium supplement. Another important part to remember with milk is very good to choose the low-fat option. Don't go now for skimmed milk and skimmed milk powder and all your no-fat products that is dairy-wise, because we need vitamin A, D, E, and K to be included in the diet. And in the fat of low-fat milk, you find these vitamins that is dissolved into that fat. So the minute when you drink skimmed milk or use fat-free dairy products, you reduce when your intake of vitamin A, D, E, and K. Fish, chicken, lean meat, or eggs can be eaten daily. When fish is chosen, it's very important to rather focus on tuna, salmon, and also snook for the low mercury content of that. Other fish and seafoods are higher in mercury, which is then also fatal for the development of a baby. No raw eggs or any product that is containing raw eggs should be contained or should be consumed, because remember, eggs contain salmonella, and salmonella can also be very harmful for the baby. Drink lots of clean, safe water. Now, the more water you drink, the better. Some mothers, that is a woman that's pregnant, reduce their water intake because they say they need to urinate too much. But your body needs as much water as possible. And it's for us as healthcare workers very important that we encourage drinking of water. Uh, we can make a recommendation to the mother to add some herbs or to add some flavorants to the water, but it should not be flavored water, because remember, flavored water contains sugar. And then the other is the limitation of sparkling water. The reason for that is gas and bloating is very prominent during pregnancy, and when sparkling water is drank, then that is adding to that bloatedness and uncomfortable feeling. But then also drinking safe water, she should limit the amount of bottled water with a shelf life. We all know that water that has a shelf life contains sodium as a preservative, and since a pregnant woman is at a higher risk for hypertension, we need to reduce that bottled water with a shelf life for consumption. So it's better to rather than tap water where you can see the osmosis process and where oxygen is actually bubbling through the water. Use fats sparingly. Choose rather vegetable oils rather than hard fats. Now we know that fats plays an important role in energy, but we don't want to add now any heart disease risk or increased cholesterol risk or increase the risk for fatty livers during pregnancy. So a mother should be conscious of how much fat she's eating, but also the type of fat that she is eating. So it's better to rather than choose margarine, for example, than to choose butter. Use sugar and foods and drinks high in sugar sparingly. One of the important parts here is that do not replace sugar with artificial sweeteners. Sometimes a pregnant woman wants to limit her intake on sugar, and then especially if she doesn't drink water, she drinks much more sodas that is free of sugar, but they're not realizing that it contains it has a high content of artificial sweeteners, and then also it has a carbohydrate, which is the gas. Use salt and fat, food high in salt sparingly. We spoke about hypertension, and we will come to this point, we will come back later. Now, very important during pregnancy is healthy weight gain. The mother needs to be reminded, and we as healthcare professionals need to remind them they are not eating for two. Most pregnant women will say, oh no, give me that second portion because I'm eating for two. A pregnant woman is not eating for two. But it's also not the time now to use your pregnancy to your benefit to lose weight or to go on some sort of healthy diet or fad diet. This is the time that you need to eat healthy, live healthy, and you need to understand that healthy weight gain will play an important role. Weight gain is important for growth and development of the baby. Also, the placenta's health is dependent on this nutrition of the mother. Amniotic fluid, the uterus. We know that in we can get atonic uterus, we can get complications in the uterus, which will lead then to postpartum hemorrhage. And with postpartum hemorrhage, the mother might bleed out and she might die. So it's very important that healthy weight gain also plays a role in the prevention of postpartum hemorrhage. Weight gain is also from the breasts that are developing because it is preparing the body for breast milk production, blood supply to the baby, and then also the fat stores. So what is healthy guidelines for or healthy weight gain guidelines? A mother can use, and we as health professionals can guide them to say in the first trimester, it is usually good if just 1 to 2 kilograms are gained in weight. And then in the second and third trimester, not more than 450 to 500 grams per week. Anything more than that, you need to watch out what you are eating or be a little bit more active. But also, the weight gain is dependent on what was the BMI, the body mass index, of the mother before the pregnancy. For example, if you look at the bottom right, you will see there is a table. If we look at the normal weight, which is 18.5 to 24.9 for a mother that is only expecting one baby, the weight gain in the whole pregnancy, the 9 months, should not be more than 16 kilograms, but also not less than 11. So we look at a healthy weight gain of 11 to 16. On the contrary, for a mother that is obese before pregnancy with a BMI more than 50, we find that we only want her to gain between 5 and 9 kilograms during pregnancy. This will differ when a mother is expecting twins. For example, you will see that a mother of normal birth, with a normal BMI, when she's expecting twins, you actually want her to gain between 17 and 25 kilograms during the 9 months of pregnancy. So how do we deal with morning sickness? How can we as health professionals help this poor mother that can hardly pick up her head from the pillow in the morning? We need to explain to her that morning sickness is usually because there's an increase in hormones. She will feel nauseous all the time. She might vomit. Some of them will not vomit, but will be nauseous all the time. Some of them will start vomiting and never stop vomiting. But it's only for 20 weeks. And it can continue, but it's hardly ever continue. But there's certain ways or certain things that we as healthcare professionals can help a mother to manage this morning sickness. We need to explain to them the concept of eat small frequent meals. When we talk about small frequent meals, people are under the impression that they have to prepare food or cook food for everyone. We can give healthy tips. For example, they need to understand if you eat a fruit and a yogurt, that is regarded as a small meal. If it is a previta with cottage cheese, then that is regarded as a healthy meal, or a small meal. So it's not necessarily cooking food or buying food or having a plate of food. Part of that is a whole plate of it. Food can be divided into two and then eaten over two small meals instead of one big meal. Nausea is usually more prevalent when there's not fresh air. When it's warm, unventilated rooms, she will feel more nauseous. So a pregnant woman needs to sit where there's fresh air. A very good tip to give to her is to keep next to the bed dry crackers, cereals, pretzels, for example, something like Marie biscuits that you can keep on the bedside table. And in the morning when she wakes up, even before she gets up, she eat two or three of these crackers, not the whole packet, but 2 to 3 of these crackers before of the Marie biscuits before she gets up. Because just by eating that before she gets out of bed, it already provides her with something in her stomach that will reduce when the morning sickness. One of the worst things that a woman can do, a pregnant woman, is to skip meals because she's feeling nauseous. If you skip meals, you will feel more nauseous, and we need to explain that to the pregnant woman, because usually what we find is people that is suffering from some kind of GI condition. When they feel nauseous, they don't eat to overcome that. And now in that mindset, a pregnant woman thinks she must also not eat, but then the nausea is becoming worse. We all know that ginger and lemon has benefits for the reduction and uh, um, of nausea and vomiting. So she can add ginger and lemon to her foods and her drinks, fresh if possible. The more fresh she can include, the better the reaction. Spicy foods should overall not be included during pregnancy because that will increase that morning sickness. Fatty foods, exactly the same. If you are feeling nauseous, you eat fatty foods, then you will become more nauseous. Drink small amounts of fluid during the day, especially water. And then if your doctor or your health professional has recommended an iron supplement, then rather take it at night before going to bed than drinking it in the morning. Another symptom is heartburn. So how do pregnant women deal with heartburn? Yes, some of them believe that there's certain um, medicines that they have to take all the time, but your diet can play a very important role. Why do we get heartburn? Because of a hormone progesterone. Progesterone will cause the valve between the stomach and esophagus to relax. And when this valve is relaxing, there's a reflux of stomach acid into the esophagus. And that is why she's getting this heartburn. But now also into combination of this progesterone in the third trimester is that the uterus, as it's increasing and the baby is growing, is putting pressure on the intestines and stomach. And then that also makes the heartburn worse. So how can the mother or the pregnant woman manage that? Again, eat small, frequent meals. Eat yogurt and drink a glass of milk or mass. So dairy products, we spoke about dairy products earlier. Very important, eat slowly, chew your food very well, eat in a relaxed environment. Don't eat very fast because heartburn will definitely come from that. So the pregnant woman wants to sit straight up when she's eating. She wants to enjoy every bite of her food, and she also wants to give it time to go through the esophagus down to the stomach before she's eating everything at once. Again, avoid spicy and fatty foods, but also now avoid caffeine. And we will talk a little bit more about caffeine later on. But also caffeine is in coffee, cola drinks, milk chocolate, dark milk chocolate. So she should avoid that when she's suffering from heartburn. Avoid drinking fluids during meals because it is increasing your stomach acid or your stomach fluids, and it makes it just easier to then cause that reflux. And the mother or the pregnant woman should know it. Another one that is important, I'm going to switch off my camera, is constipation. Constipation is a big problem during pregnancy. It can also lead to hemorrhoids. It makes it worse during pregnancy. And fiber plays a very important role. Previously, we spoke about fruit and veg, eat it raw. Um, Dried fruit and prunes can be eaten. I know there's some older women that will say prunes will only be effective if you soak it in water overnight and then you drink the water and then eat the prunes. But no matter how you eat the prunes, it will help. Drinking water, not liquids, water. And then prune juice can also be successful. But you have to be very careful drinking prune juice because it's very concentrated and it contains sugar. Now, I'm just going to use Weet-Bix as an example, the importance of water. We have two types of fiber. You have soluble fiber and insoluble fiber. Now, insoluble fiber is your roughage. It is like Weet-Bix, all bran, whole wheat bread. Um, it is pips and peels of your fruit and veg. And there is some sort of belief that the more roughage you eat and the more fiber you eat, the more you are treating constipation. However, this is not always true because it can help if you drink a lot of water. And we need to understand, if you do not drink water, roughage and fiber will make you more constipated than what you are. If you take Weet-Bix, for example, and it's not, I don't have anything against the brand, I'm just using it as an example. So if you put Weet-Bix in a bowl and you put water or milk or anything over that, it will soak up all the fluid. Now, when you eat that and it comes into your body, it still will absorb water or fluids that is in your body. And for this fiber to be fully digestible in your body, for one piece of Weet-Bix, you need 2 additional glasses of water during the day for digestion when you are constipated. So it means apart from your 6 to 8 glasses of water that you normally drink during the day, you have to add on 2 additional glasses of water to one piece of Weet-Bix or one portion of the roughage that you are eating. So when we are talking to pregnant women and they do suffer from constipation, it is important to understand How much do they drink when they eat a lot of roughage? What type of fiber do they include? It's also better for us to then also um, emphasize oats, apples, and carrots because that contains soluble fiber. That means it doesn't need additional water to the normal amount of water that she's drinking to be used in the body. And then always be active. Pregnant women, sometimes they think they need to sit all the time and they need to be served by everybody. I understand that last 2 weeks when you're feeling very uncomfortable, but during the pregnancy, it's important for a pregnant woman to have brisk walks or light exercises. Okay. Prevention and treatment of hypertension. Now, the danger of hypertension during pregnancy is preeclampsia. Mothers die because of preeclampsia, and babies will be orphanaged. So it's important for us as healthcare workers to keep a very close watch on the hypertension. But also, it's a responsibility of a pregnant woman to do her share in reducing and keeping her blood pressure healthy. Limit the intake of salt and food containing salts. Processed meats, canned foods, anything that has a shelf life. Luncheon meats, ham. Sometimes they will say, oh, I'm just snacking on ham or I'm just snacking on Viennas. From time to time, they've got these cravings for Russians and for Frankfurters. It is everything things that is containing salt that will increase the risk for hypertension. Pies, cheese. When you look at cheese, cheese is highly processed and it contains a lot of fat, but it also contains a lot of salt. In this case, you rather want the pregnant woman to choose white cheeses or cottage cheeses, your smooth cheeses. Takeaways, ready to heat and eat foods. Everything, like I said, canned foods. Everything with a shelf life, she needs to be cautious of. Chips, crisps. She also needs to be peanuts and nuts, even if it's healthy. Just be aware that it's unsalted and not salted. Limit the intake of caffeine. I always laugh when people say to me, I don't drink coffee, I drink black tea or English tea or Joko or Glen or Rooibos because that contains caffeine. So if you reduce coffee, you also have to reduce tea. I'd rather go for the decaf options. Or in South Africa, we've got Rooibos tea. Or go for a herbal tea like peppermint tea that will also help with bloating if a pregnant woman has bloatedness. Or lemon and chamomile tea. So rather go for that type and options of teas. And be conscious when you have a flavored tea that it's not a flavored black tea. It needs to be a flavored a green tea or a flavored rooibos tea. Um, Milk and dark chocolate. So if I say milk chocolate, I mean the brown chocolate. Contains caffeine because of cacao. Hot chocolate contains cacao. So sometimes I will say, I'm not drinking coffee, but I'm drinking hot chocolate. Hot chocolate is made or contains cacao and cacao contains caffeine. So when she does have a craving for chocolate, in the first place, usually you have a deficiency in magnesium, and it's good to discuss it with your health provider to see if there can be a multi-supplement, multivitamin mineral supplement that contains magnesium. But on the other hand side, if you really feel you need that chocolate, rather than go for a white or a caramel type of chocolate. Cola drinks, even though they will go for no sugar, remember no sugar contains artificial sweeteners which might be dangerous. But on the other hand side, you do get low sugar options that still contains caffeine. So if you choose to drink that then on your own decision, then make sure that you are drinking both that is free of caffeine and so healthy living during pregnancy. Supplements should not be used if not discussed or prescribed by healthcare workers. Supplements can be very dangerous if you don't know what to do. So as a health professional, it's very important to discuss supplements as a topic on its own with a pregnant woman so that she understands what she can and what she can't. The same with medicine. No alcohol, no smoking, no drugs, limitation, exposure to paint, glue, nail polish, gasoline, and fumes. So sometimes a pregnant woman feels she must go court or um, very often she must go for manicures and pedicures, and then she's exposing herself also to that nail polish fumes. So she must just limit. I don't say she can't go for a mani and pedi. I'm just saying she must limit the exposure to that. And then in a case of when a pregnant woman is having sex, it must be not be unprotected, because in a case where she's HIV positive, she can get reinfected with another HIV strain. If she's not HIV positive, she might get HIV infected, and then also STIs. And STIs will make complications and cause complications during birth. Now, how do we support this breastfeeding mother in a confusion? Should she be breastfeeding or not? There's not one pregnant woman, whether it's a first baby, a second baby, a third baby, whether she's not considering that, does she want to breastfeed or not? We need to understand there's a lot of influences also from outer circles that is influencing this decision, and we as health professionals need to play a very prominent role in helping her to make the right decision. So as health professionals, we need to have certain discussions, far more from what I've listed here, but I think this is the most crucial ones um, that we have to have with her. The first one is to discuss the benefits of breastfeeding. But as health professionals, we first go for cheap. Breastfeeding is cheap. Um, we also want to say breastfeeding is available, but we need to understand what is the individual circumstance of a mother, and we need to sell breastfeeding to her that will solve her problems, that will be beneficial to her individual circumstances. And we need to understand that by asking her questions, not just assuming. Um, I remember when I was working as a dietitian, I said to a mother that in one of the very poor communities, I said, you know, breastfeeding is cheap. You can just breastfeed. And she looked at me and she said, you know what? Even if I'm poor, I don't want cheap things for my baby. I want the best for my baby. And that kind of startled me to think about how do we present breastfeeding and the benefits of breastfeeding to mothers. Are we as health professionals not partially um, to blame for the fact that there's a negative association with breastfeeding? Then also, she needs to understand exclusive breastfeeding, what it means. She needs to understand it is for 6 months. Usually by 6 weeks, they start to give water. By the second or the third month, they are starting to give infant cereals. They think that the baby is not having enough. The baby must get extra infant formula. So we need to explain to her what is exclusive breastfeeding. We need to talk to her about no other milk and bottles and dummies. She needs to understand that so that she can go back to her friends and her family to say, you know what, I've chosen to decide. If you give me a gift, please do not buy me a gift that is including any milk or bottles or dummies. She also needs to understand there will be times when she will be separated from her baby. How is she going to express breast milk? How is she going to cup feed the baby rather than choosing a bottle? So that's the type of things we need to explain to her. What is the dangers of mixed feeding? When I talk about mixed feeding, it is infant formula and breast milk, but also if I choose to breastfeed from my breast and using a bottle, what is the effect of that also? We need to emphasize HIV. Remember, when a mother is HIV positive and she's mixed feeding, she's increasing the risk for transmission of HIV to a baby. Nipple confusion, which will at a later stage cause the baby to refuse the breast, which will have financial implications for the mother. So although she's pregnant now, we need to explain these things to her because she has 9 months to think about it and she has 9 months to prepare for it. So we need to make sure that she understands all these messages for her to be successful in breastfeeding. We need to explain to her how milk is produced, what is the factors that will increase prolactin and oxytocin. We need to understand breastfeeding is on demand whenever a baby will. We also need to talk about a mother, what was her previous experiences. If it's a first pregnancy, I hate it when they tell a mother it's not so and it comes natural. That's a lie. The first few breastfeeds are very sore. It is unfamiliar to the mother. She doesn't know what to do. It doesn't come naturally. So we as health professionals need to prepare her. We need to support her with information as much as possible. Not in such a way that we scare her for breastfeeding, but we need to make sure she's ready to breastfeed. Um, when there's a mother with a second or a third pregnancy, we need to address when she had unsuccessful experiences previously. We need to understand what was the reason for that unsuccessful breastfeeding experiences. How can it be corrected or how can it be prevented in the future with this breastfeeding? Myths versus facts. Um, there's this myth, for example, to increase breast milk production, you have to drink a lot of brownish yeast. Um, that's a myth. We need to put the facts. If you want to increase breast milk production, you put your baby more to the breast. You drink lots of fluids, you eat healthy. So we have to balance that and we have to go through conversations with a pregnant woman for her to understand all of these things. In a situation where a woman had previous breast surgeries, whether it was a breast enlargement or whether it was a breast reduction or they removed the lump from the breast, we need to understand that the position of where the surgery is will affect breastfeeding. If it was a breast reduction or enlargement where the areola was removed, then the nerve endings was damaged and breastfeeding will not be possible. Because with the stimulation of the nipple, the nerve endings is not working and functioning. And in such a case, we need to find alternative ways. But if the areola and the nipple was not affected and she has still feeling and senses and your the nerve endings are still working, yes, then she can continue breastfeeding irrespective of whether she had surgery before or not. What is the role of a father? What is the role of a supporting family and friends? In some cultures, we talk to the mother about breastfeeding. We want to empower her, but maybe it's not her that's making the decision what type of feeding method will be followed. In most cultures, it's the mother-in-law that makes a decision whether this child will get breast milk or whether the child will get infant formula. And in such a case, we as health professionals need to understand that so that we as health professionals can not only counsel the mother, but also include the extended family on and the decision maker into this counseling process. We need to explain to the father when the father is available, what is his role? Yes, they feel excluded with breastfeeding, but there's other things that they can do with the baby to help the mother. It's not the sole responsibility of the mother to take care of the baby because she's breastfeeding. There's other things that he can also do. And then we come to preparing the breast for breastfeeding. So for some other reason, there is a belief that breasts need to be prepared for breastfeeding. And that is totally a myth. As a mother or a pregnant woman goes through this process, um, the body will prepare itself for breastfeeding. The breast will enlarge, Milk production will start, and the body will just set itself up naturally for breastfeeding. Now, if we think about the anatomy of a breast, it's important for you to explain that to the pregnant woman. She needs to understand how milk is produced, where it's coming from, because that will, in a later stage, when we talk about positioning and attachment, when we talk about expression of breast milk, that will make sense for her because she already understands what is the role of each and every little part, the nipple, the areola, the milk duct in her breast. Very important, size does not matter when it comes to breasts. In some cases, I think that the bigger the breast, the more breast milk there is, the smaller the breast, the less the chances. I was in a support group where the lady was saying, it is my small cows that has the most milk. So it does not matter. You must remember the bigger the breast, the more fat tissue there is. So in some cases, you have to assess the size of the breast. It's uncomfortable to position the breast with a baby. So you need to assess the size of the breast as well and prepare the mother accordingly. Very important. It's not necessary to prepare nipples. I'm just drawing your attention to the picture on the bottom right. We need to understand babies are not drinking from nipples. They are drinking from areolas. If we as health professionals understand that and we explain that to the mother, then it will make our job easier postpartumly when she needs to breastfeed. So no, nipples do not have to be prepared. However, we do need to test the nipple to see if it retracts easily, if it's an inverted nipple or a flat nipple. For the very reason that because the baby is sucking in, if I can take you back to the picture at the bottom, remember when the baby is sucking on the breast, the nipple is extending to the back of the mouth of the baby. So for that reason, you assess nipples to see if it's inverted during pregnancy. If it's inverted, it's flat. Remember, the baby is drinking from the areola. The mother can still continue to breastfeed, but there is some exercises that you can do. So on the right-hand side, you can see there's a very simple exercise which she can do during pregnancy. She must press in firmly the base of the nipple and pull her thumbs apart to help draw out the flat nipples. So she can do it as often during the day when she's one or twice when she's dressing or undressing. She doesn't have to schedule it every half an hour. She can do it whenever she's getting dressed. Also, do not apply any creams or alcohol. I think we must apply alcohol to make the nipples strong for when the baby is suckling. In mere case, it will cause cracked nipples during breastfeeding. And when there's cracked nipples, it makes it very hard for the baby to remove the milk from the milk ducts. And cracked nipples will then lead to engorgement. And engorgement will lead to blocked milk ducts. And blocked milk ducts will lead to mastitis. So it will cause much more problems for this mother. And it's just better to to wash the nipples with clean water. Also, for the HIV positive mother, we need her to understand once she has cracked or bleeding nipples, it will increase the risk for HIV transmission to her baby. So in conclusion, we know that healthy eating and living is important during pregnancy. We actually need to start already in younger years than just being pregnant, because it is important for the baby, for the mother to prepare her body for pregnancy. 2 months before pregnancy, you can already start with healthy eating and living to prepare your body for conception and for pregnancy. There's morning sickness, there's symptoms that the mother is experiencing of a pregnant woman, and we need to use food and not medicine to treat that. When a mother is eating healthy, when she's living healthy, it will set her up for the birthing process. It will make her healthy after birth, the recovery after birth will be much easier if she is in a good nutritional status. Then also for the baby, the birth weight of the baby is important, and also later stages whether this baby will then develop or be at risk for development of diabetes, hypertension, obesity, and heart diseases. It is important for pregnant women to understand they do not eat for two, and we need to explain to them the healthy weight gain process and the expected health gain. Supplements are dangerous. Do not take it without any consultation by a healthcare worker. And we as health professionals need to counsel pregnant women and guide her and her support system what is necessary according to her individual circumstances. Breast is best at all times, and that is our message to the support system, to the pregnant women, and we need them to understand breastfeeding on demand. She also needs to understand that preparation for breastfeeding is naturally, she doesn't have to prepare a breast, and then also there's no need to prepare her nipples. A breastfeeding, which is a golden drop, we will still, and as long as I live, I will proclaim this message that breast is best and breast milk is the golden drop. Thank you so much. I appreciate your attention.
Wow, sure. Thank you, Dr. Magda Botha, for that very informative webinar. That was so insightful. For me, being someone who does not have children yet, I really found this informative, and I feel like I have a wealth of knowledge available to me. And we've mentioned at the start that this webinar is recorded, and so it will be available on YouTube. So me, including anyone else who would like to, can just hop onto YouTube as soon as it's there, and we will have this knowledge available to us. Thank you very much, Dr. Magda. So we do have a few questions that came in. One of the first questions here is that a member is saying, good knowledge and advice for pregnant women. What I want to know is, how will the diet actually affect the milk, and will it impact the ability to breastfeed?
Okay, thank you so much for that question. The short answer is no. Whether the mother is malnourished or not, it will not affect the ability to breastfeed. She will still continue to breastfeed. However, it is wise then for the health professional to support the malnourished mother to increase milk supply. But we have to understand, although nutrition is setting her up then for breastfeeding, it is important to understand it's a natural process. And when a mother is putting the baby to the breast, oxytocin and prolactin are increased, and that will cause the breast milk production. So no, whether the mother is eating healthy or not, breastfeeding can still continue.
So thank you very much, Dr. Magda Botha. So on that, you now just mentioned it's important to then just support the malnutrition mother. It links to one of the questions we have here. And I believe that actually that you have answered it well during the webinar. So the question is, how can the midwife support the mother? And I know that during the webinar and your presentation, you really focused on the discussions that we have with or that the healthcare professional should have with the mother. But is there anything else you would like to add on support the midwife, specifically supporting the mother?
So a midwife is in an unfortunate position of getting a mother when she's giving birth. She doesn't know the mother had any antenatal experience until she opens that record. And in some unfortunate cases, when the midwife opens, there was one or two clinical visits and there was no information. So the first important part is her focus is not now breastfeeding. She's in labor. So the midwife cannot teach her anything now while she's in labor. But the most important part is after that baby is born. Once that baby is out and skin-to-skin contact is being initiated, the midwife can support the mother to immediately put the baby to the breast. Where the midwife can, if there's two midwives available, can already start counseling her on, yes, you are going to feel a little bit of pain, but it's normal. The midwife can be in the next 6 hours to 8 hours, plays a very important role to make breastfeeding successful by giving her as much information as possible. And make sure before she's discharged, before the mother and baby is discharged, that that mother knows how to breastfeed. Positioning, attachment, holding the baby, putting the baby to the breast, reducing it, staying with the baby, not removing babies. Some midwives think they need to allow the mother to rest and then they remove babies from mothers. Mothers and babies need to stay together. And we as health professionals, we can support that by not removing babies. It's not our babies. It's a mother's baby. And we should not take care. We should empower that mother to take care of the baby.
Yes, absolutely. Empowerment. And we agree on that. Thank you very much. So with that, we also had, this also actually links to the diet. Two questions, separate questions that came in, but let's tackle them together if you don't mind. The one question was, what about drinking energy drinks for a pick-me-up, like Switch or Monster? And then the other question is, can pregnant women drink kombucha, which is a fermented effervescent black tea?
Okay, thank you so much. So firstly, coming to Switch or Monster or Red Bull, it's very high in caffeine. The pick-me-up is from the caffeine. And we really do not recommend anything like that during pregnancy. So it's important that she needs to understand not to take any of that. To come back to kombucha, kombucha is from black tea. Black tea is a source of caffeine. So yes, if she takes kombucha, remember we said that caffeine or coffee, it's 2 cups or less. That needs to count as one of her cups. But no Switch, no Monster. It cannot count as any of your 1 cup. So yeah, if it answered the question.
I believe you answered it very well. Magda, thank you. I also learned something. And I would like you, Dr. Magda Botha, to just emphasize again what you've said during the presentation regarding caffeine, and more specifically, actually, not necessarily the caffeine, but the drinking sugar-free drinks. Because that is another question that came in from one of our attendees, is that they know that caffeine is not recommended for pregnant women, but if they are drinking sugar-free drinks, and maybe she missed that part, just to emphasize the importance of not drinking unsweetened or sugar-free drinks.
Okay, so the part about the sugar-free, caffeine-free is, yes, there is caffeine-free options, but because the safety of artificial sweeteners during pregnancy was not established yet, it's very, the pregnant mother needs to be conscious about the amount or about the consumption of sugar-free drinks and sugar-free products. So it's wise to teach the pregnant women to read labels, to see what is the artificial sweetener or what is the replacement. That was nowadays you get a lot of xylitol, erythritol, aspartame. So there's a lot of different artificial sweeteners, and we as health professionals needed to understand she needs to read the label. If it's a sugar-free option with no artificial flavor, if you make your own iced tea and you don't put any sugar in and no artificial sweetener, then go for it. But it's about that artificial sweetener. And yes, even if it's caffeine-free, sugar-free, just look out for the artificial sweetener.
Okay, great, very insightful. Thank you very much, Dr. Magda, just for emphasizing that again. 2 more questions, and then I think we can conclude. So one of the questions that came in is that if a mother finds that she can't breastfeed for whatever reason, but she still wants to feed her baby breast milk, then what other options are available?
Okay, so there's a whole process that needs to be followed. It's actually you use a breast milk supplementer, which I believe if anyone needs more information on that, we can share. But in a case where this mother, she needs to understand that breast milk production is regulated by hormones. And the more the breast is stimulated, the more milk will be produced. You want prolactin and oxytocin to increase. So in a case like this, it's important that the mother understands she must express. Also that when she feeds the baby, she must put the baby to the breast more often. There is massages that the health professional can teach her how to stimulate breast milk production, so she doesn't necessarily have to always put the baby to the breast. In a case where the baby is not drinking from the breast now, she can use that breast milk supplementer where she's actually connecting the baby to the breast, but then she also gives a supplement while the baby is drinking through a tube so that the mother and the baby, yeah, I don't have a picture now. Don't want to get too complicated, but yes, there is ways, but the more she puts the baby to the breast, the more she stimulates it, the more milk will be produced, and obvious fluids and healthy eating plays a very important role in that.
Sure, thank you very much, Magda. And I then really think our very last question is that during the presentation, you've placed lots of focus on exclusive breastfeeding. And we know it's not only you that's placing emphasis on that, but also hospitals and dietitians. They are placing that emphasis on the exclusive breastfeeding. So the one comment you made during the presentation was that when we are asking for gifts, and something I should remember to put on my list, that please do not give me any bottles. Can you share with us more reasons as what will the impact be if they are going for bottle feeding instead of breastfeeding? The other reason I'm asking that question is we got a comment from one of our attendees, Carol Symington, and she said, sure, thank you. It lets us think. I'm sure most of us, the first thing we say is the breast is free and that you won't be able to afford formula. It's demoralizing people and it's linking breastfeeding to poverty. So therefore, mothers might end up giving formula and milk bottle feeding if it will show that they are rich and they're not poor. So what is your comment on that?
Okay, so this one is very close to my heart. Carol, I know you know this one is close to my heart. I worked with Carol in the Free State. So I saw as a young dietitian, I saw a lot of babies dying because of bottle feedings and mothers that's coming from a poor background. Where she actually wants to show that she's rich and she can care for a baby and she wants to give her baby the best. And then it comes up in the way that we are promoting breastfeeding. And we need to understand that a mother is in the best position to care for a baby. A mother is the household food security for a baby. That's how God created it. A mother must provide and can provide in a baby's needs. So in a case where a baby is bottle fed or needs to get infant formula, there's other ways than bottles. We understand that bottles are dirty. It's not being, even if you sterilize it, bottles still have dirt traps. That dirt trap, there's lots of studies that's being conducted to show there's areas if you use your hand or whether you are using a bottle brush, whether you are using a sterilizer or the microwave, there's areas in the bottle where E. coli, Klebsiella, for example, is sitting in the bottle. And over time, that will cause then the baby to get gastroenteritis. So it increases the risk for gastroenteritis. Another one is mothers that sometimes give bottles. They like to put the baby down with a bottle, and then the baby will get otitis media. The baby will get ear infections. Respiratory disease will increase with bottles because breast milk has this benefit of antibodies and immunoglobulin A and immunoglobulin D, which is an immunoglobulin G, which is so important. Colostrum, which is the first immunization for the baby. It's very high in all these immunoglobulins and in vitamin A. So there's nothing that can substitute that from breast milk, even though we are trying with artificial things. But there is cases where a mother needs to give infant formula. Then we as health professionals, we need to support that mother. We shouldn't alienate her. We shouldn't let her feel that she's worthless. Because people like me that's very passionate about breastfeeding, we forget about that mother that feels worthless because I'm scolding her for not breastfeeding and I don't know her circumstances. But then as a health professional, I need to be conscious and neutral enough to also explain to her what she needs to do, what is the precautions that she needs to take to make sure that the baby is not at risk for gastroenteritis or otitis media or respiratory diseases or obesity or allergies. So as a health professional, I also need to have enough information about artificial feeding methods so that I can help a mother that's not breastfeeding.
Sure,
It was
sure.
now a very long response, but yeah.
No, but thank you very much, Dr. Magda Botha. We so appreciate that. We can hear your passion through the way that you are explaining and sharing your knowledge. So thank you. We have gone over time, but I'm certain that everyone who has joined us didn't even really realize, since they can also experience your passion in the way that you are sharing. So I believe everyone is okay with going over the time. But just thank you. Thank you very much for this webinar, the passionate subject and the gold standard, and sharing that. It's inspiring to see. So thank you so very much, Dr. Magda Botha. We have run out of time. We do not have any more questions. We do want to mention, though, you shared about the different diseases that can be picked up by a baby, the gastronitis, and you've mentioned a list of illnesses. So just remember, for everyone listening, here at Sanapi, we do have the Sanapi feeding cup, as well as our enteral feeding bottles, both that are can be washed away and be cleaned in a way that will not harm your baby. There's no micro dirt traps. It is a safer option for your baby to use. And we have those available for cup feeding, should breastfeeding not be an option, and also to do enteral feeding and freeze your milk if necessarily in these bottles and products that have specifically been designed for these issues. But thank you very much for tuning in. Rita, anything else that you would still like to say before we conclude completely?
I just want to say thank you so much to Dr. Magda Botha. It was an absolute delight listening to you and giving us more information on breastfeedings. I personally feel much more prepared, and I think also the midwives and dietitians feel much more prepared in regards to how they can assist pregnant mothers preparing for pregnancy and breastfeeding and so forth, as well how we can support them with breastfeeding. So thank you so much. Thank you to all our participants, and we will load this on YouTube. Thank you.
Thank you. Have a good day.